This episode of Bartholomew Town is brought to you by the University of Rhode Island Online, Newport Film, Navigant Credit Union, Half Street Group, and Health Source RI for employers.
Bartholomew Town.
All right. Welcome into Bartholomew Town. I'm Bill Bartholomew. Always a pleasure to spend some time with you here on the podcast or the radio, wherever you're listening. You can find every episode at ripodcast.com, on Spotify, Apple, or YouTube, and of course on Saturdays on WPRO radio. Okay, so today we're talking about something specifically that it's a great asset to our community, particularly at a moment where we have a lot of intersectionality in public health, and really at a moment where, look, let's face it, some of the most vulnerable people in our community are more and more seeming to fall through different cracks as our federal government shifts. And even here on a local level, we've seen enormous problems with dental care in a number of different ways. Some of this has to do with things we've talked about extensively here on the podcast, reimbursement rates and so on and so forth. But today we're talking about something that is really just direct impact. And that is, I think, the simplest way to put it. And that is Mission of Mercy. Doctor, I guess the best way to do this, if you want to introduce yourself and give us the brief overview of what Mission of Mercy is all about.
Hey, Bill. Thanks for having me. My name is John Kiang. I'm a pediatric dentist here in Rhode Island. I practice here in East Greenwich and Coventry. But as it pertains to the Mission of Mercy, the Rhode Island Oral Health Foundation is the organization that puts on the Mission of Mercy each year. And our board is a group of community leaders and oral health providers. And so I'm fortunate to be part of that amazing group of people. And our mission is to treat the underserved here in Rhode Island.
Exactly. I mean, that's the big key here, is that this is a free dental clinic. It's, you know what it literally is? It's a pop-up dental clinic for the underserved. And you do amazing work. So how long has it been operating for? And kind of give us the sense of what we'll call it Mission of Mercy Day looks like.
Sure. This was the brainchild of Dr. Jeffrey Dodge, who established the Oral Health Foundation basically in 2011. He was kind of laying the groundwork for a Mission of Mercy here in Rhode Island. There are others across the country. He saw the need and the vision of putting this together. So he kind of touched on a few people that he knew personally and put together a board. And so we've been going strong, since 2012, with a hiatus of COVID in between. We just had our most recent event at the Providence Community Health Center in October 4th and 5th of this year. It's a first come, first serve basis where patients start lining up at 5:45 a.m. This year the line wrapped around the block. The need is definitely there. And how the process works is, they are treated basically off of one need that they have. Whether it be, a bad tooth or, a filling that may need to be done, a crown, and that sort of thing. So we kind of triage them through medical, then do dental triage, and then they are funneled to the particular department of need.
Let's talk about the planning behind this, because it's an amazing event that involves a lot of different dentists and oral health providers in general volunteering their time, literally. What goes into planning, and talk about the different players, if you will, people on your team and everybody's role in making this happen.
Sure. We have an amazing executive director, Libby Swan, who is really the head of everything. By title, I guess I am. She really runs the show. And it is once we're wrapping up and cleaning up on October 5th, as we were this year, we're planning for next year. And it's a year-long process to have the 2-day event. And it involves quite a bit of an undertaking in terms of raising funds is always, an issue with any type of organization such as this. And, we have some amazing partners through Providence Community Health Center, Delta Dental, our community. Volunteers are donating money as well as their time. And so, it is United Health helps us, Lifespan or any of the organizations that are, donating in-kind services as well. It is really from top to bottom, a pure donation-based organization where we're using, for every dollar that we get, we're converting that into $7 to $8 worth of care. So we're really, utilizing those funds appropriately, and it goes straight to patient care.
What does this say in your mind about Rhode Island's oral health community, where you have people literally just saying, you know what, I'm giving up a weekend day to go work for free? What does that signal about? Because to me, that signals, you've got a group of people that care about the work they do. They care about their community. What's your read on that in terms of why people in your profession are giving up their time and resources?
Yeah. I'm actually truly humbled by our volunteers. Especially our dentists, our hygienists that are getting involved. It is the best of the best. Honestly, I say this truly if you were to attend the event, it is Rhode Island's best dentists that are there, and it shows and exemplifies how great our providers are in our state, and how they're just selfless. They just come out when there's a need. They're always there. It's the same faces each time, and I'm proud to be a part of that group. And it's and our community volunteers too. It's the same faces for a decade now who show up, who know what they're doing, who provide the utmost care and compassion for people that have been waiting 6-7 hours before they're able to get treatment. And so it's a really, really remarkable thing to witness.
All right. So access to care and Rhode Island. Look, Rhode Island Mission of Mercy was essentially created to address accessibility gaps when it comes to oral health care. I've already outlined some of the basic challenges that we're facing right now here in Rhode Island, which have been, we've talked about this extensively with the Rhode Island Dental Association, Delta Dental. I mean, a number of voices have repeatedly on this show kind of outlined the specific challenges with dental on a reimbursement level, on a recruitment and retention level. There are all these factors, but look, we see more than anything right now a huge amount of stress in the community about potential premium increases when it comes to 2026. Even yesterday on the radio, we had Lindsay Lang from Health Source RI talking about how people might be seeing 100% or more increase in their health premiums. That all kind of bundles into a lot of people's mindset when it comes to dental insurance and what they can afford. And the fear is a lot of people are just going to say, you know what, tax penalty aside, I'm not going to have any insurance. So we're seeing a widening, or at least potential for widening, need a pool of people who are going to be in need. So let me ask you, as somebody who's on the front lines here, where are you seeing improvements in oral health in Rhode Island, and what still needs work?
Yeah, this is a big topic, right? We often we often try to separate the medical dental component, right? Because it's separated through insurances, and that's kind of really how we've always dealt with oral health in United States. But they really are interrelated, right? If you're going to have families who are struggling to pay insurance premiums and or dropping them because of just the lack of finances, that is a trickle-down effect to dentistry as well. And so we are at a crisis here in Rhode Island. I think it's pretty obvious, with the recent financial struggles in which a lot of our neighbors are facing. It puts a strain on everyone from top to bottom. And so where are we in the dental realm? Unfortunately, we have an aging population of dentists. There's going to be less access to care in that regard because there's just not going to be enough of us around. We need to do better in recruitment of getting younger dentists to the state. Unfortunately, sometimes it's challenging. Our neighboring states pay a little bit better. So that is a little bit of a hindrance to us. Where I think we're excelling is that we recognize the problem. If we are able to recognize the problem, we can put in place some type of solutions, whether that is loan repayment, which the Rhode Island Oral Health Foundation, or the Rhode Island Foundation rather, is put in place to try and recruit younger dentists and retain younger dentists who are, active in the community here. So, there are certain things and programs that are being put in place, but unfortunately, we're kind of behind the eight ball in that regard.
Yeah. And unfortunately, we are also, like I said, we're seeing, and I'm sure you're well aware, although dental premiums may not necessarily be affected by some of the changes that are coming, they may be affected too. We're trying to actually gain a better understanding of where things are going to shift for everybody. And we may not know until we look if whether or not the government reopens. Now it comes to play. But this is no doubt not a time where it's getting easier for a lot of people who are on that cusp of sustainability when it comes to their ability to purchase insurance, period. And that's the fear, I think, more than anything, is people are going to say, all right, it's getting too expensive on the whole. Let me wing it. This now sounds like pre-Obama in terms of an environment. What does that do? How do you prepare for that? Can you see a day like Mission of Mercy satisfying an entire gap there, or what do you look at?
That's a tough question. I don't think anyone really has the answer. And how do we combat this at the moment? Maybe additional programs such as additional Mission of Mercy type things. Events happen more throughout the state, but that is sort of a Band-Aid. That doesn't fix the problem. It addresses kind of the immediate acute need of patients, whereas we need to get behind preventative care. Making sure that people are taken care of appropriately, not when they're in a crisis, but overall health management, through the long term. And so, while the Mission of Mercy is a fantastic event and it's much needed, especially within that South Providence community, we need to address the bigger system. And so, do I have those answers? No. I leave that up to our public policy people who are maybe a little bit more well versed than I am to make that happen. But I fear for situations where if Roger Williams or Fatima Hospital closes for any particular reason with this this non-sale, where exactly those communities going to be?
Yeah,
and so it's a tough situation.
Bartholomew Town.
Are you ready to take the next step in your career? URI Online offers business and leadership-focused programs designed to fit your life. Whether your goal is to advance in your career in fields like public administration, supply chain management, or training and development, their online programs provide the flexibility you need with the high-quality education you deserve. Learn more from experienced faculty and collaborate with a network of professionals, all from the comfort of your home or wherever life takes you. Visit uri.edu/online to explore programs and start building your future today. URI Online. Learn anywhere with us. As Rhode Island's first ever member-owned credit union, Navigant Credit Union has been a staple in the local business community for more than 108 years. Today, Navigant is a $3.4 billion institution serving more than 136,000 members across 25 physical branch locations. But since its founding in 1915, the mission has never changed. Navigant Credit Union's team of financial professionals have remained committed to improving the financial well-being of the families, businesses, and communities they serve across Rhode Island. Learn more at navigantcu.org.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,200 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our more than 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health and dental insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.
We're brought to you in part by Newport Film. Make sure you check out their indoor film screening series by visiting newportfilm.com. Half Street Group brings a new generation's perspective to leadership communications, strategic public relations, and digital marketing. Half Street helps organizations and leaders take control of their own stories and manage their reputations. They get results for their clients by focusing on audience, message, and culture, and by leveraging their decade-long relationship with media and opinion leaders in the Ocean State and throughout New England. Join me and Half Street Group founder and president Mike Rea for a conversation every month about news of the day, the hottest media analysis, and a look behind the scenes at how impactful leaders drive conversations. Learn more at halfstreetgroup.com.
Right now.
Tough situation. It just further outlines that oral health is healthcare, and this is all one holistic system, even though, like you said, on a commercial insurance level, it's divided along with, eye care or things like that. All right, let's talk about the successes that you've had in 2025. Just about a month ago, you had the 2025 Rhode Island Mission of Mercy. Is it? I may have misspoke. It's a 2-day program, right?
2-day program. Yeah. There's a weekend a year in which we host the event. This year, we saw over 600 patients. We provided about $300,000 worth of care with hundreds of volunteers. And every year that we do it, every year we refine our systems. Every year it gets better. And I get excited for each year because it has become a well-oiled machine to the point where we're working on the minutia things now. Like, was the food really good? Was this, these small details that make a huge impact on the day of the patients that we're seeing. So, it was a great success this year. I look forward to next year, and we're already planning and fine tuning some of the things that needed some work this year.
Okay. Rhode Island is a generous state. For folks who are hearing this right now and they say, you know what, maybe I'm not a dentist and I'm not going to go perform minor oral surgery on somebody on the weekend, but I want to make sure I can support that. What is the procedure in terms of accepting need for you from either a financial or any other way that someone may want to support this incredible program?
Yeah, so I don't discredit, we need all kinds of volunteers. I would say if you have a special linguistic skill, if you are bilingual in Spanish or Creole, and you may be even low on funds and you can't donate, but you can donate your time and your skills, we would love to have you. If you're working in large parking lots and management of cars and are able to come out and help us, manage the flow of people. And that is kind of what you do for a day to day. We would love to have your expertise. So it is while we would much appreciate funds. I think our volunteers really kind of do make the event. But that being said, we are always looking for finances. We just need to. We live, basically, plate to mouth, so it's a hand to mouth type of situation where each year we're trying to make sure that we're hitting our budget so that we can put on the event. And so we're always actively, pursuing grants. And if you want to donate $10, please, Google the Rhode Island Mission of Mercy, and there's a PayPal link where you can just donate your $10, and it's very much appreciated.
And I've actually gone ahead and linked your website in the show notes here. So wherever you're listening, just go ahead and click on that directly. Doctor, thanks so much for your time. This is an incredible program. These are the types of things that, as we explore healthcare in detail here in the state on this show and otherwise, I think sometimes it's easy to get discouraged. I know I recently had some oral surgery done and, maybe too much, had conversations before and after the numbing agent was inserted with my oral surgeon about some of these challenges. And it's just amazing, to see the sprint, the marathon, actually, that providers go through every single day, and to be able to then step up even more and offer literally volunteer services to the most vulnerable people in our state. Rhode Island Mission of Mercy, it's an incredible program. Thanks so much for your time today as well.
Hey, Bill, thank you for having me on. Appreciate it.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,200 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our more than 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health and dental insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.